In this month's Overcoming Pain segment, Spine Pain Diagnostics Associates Dr. John Birgiolas discusses acute and chronic pain.
So acute pain is normally when a patient experiences pain for less than 6 months at a time. And a good example of that would be an acute muscle strain in the low back. So a patient can have excruciating muscular pain for weeks to months, but given enough therapy and anti-inflammatory medications, that tends to go away. Whereas with chronic pain, that tends to be pain that lingers for greater than a 6-month period of time outside the window of normal treatment and therapy. The most common type of pain that we see in our clinic is arthritis, usually involving the joints in the low back, and those are called facet joints. So just like the knees and the hips, over time, given enough wear and tear on those joints, patients usually come in with deep aching low back pain, with oftentimes having referred pain into either the hips or even into the lower legs. A lot of times we see patients who have pain either where it feels like it's in the buttocks or in the hips or down the legs even, and that can actually be caused from the spine, and that's called referred pain. So even arthritis in the middle part of the spine can cause pain that actually feels like it radiates out into those different areas of the body. It is important to deal with chronic pain in a timely manner, because if you let the pain linger and worsen over time, that can actually result in inflammation which spreads to different joints, to different muscles, and this usually can aggravate the overall picture of how the patient's going to do. So if someone is in chronic pain, I'd recommend that they at least come into our clinic so we can perform a full history and physical examination and possibly perform more diagnostic techniques so that we can intervene with their pain in a timely manner before it gets worse. I'm going to answer one of our viewer submitted questions. So Jason asks, Dr. John, what is one of the more serious spinal issues you've seen at your office? So probably one of the most severe cases of a patient coming in with excruciating leg pain that I've seen was caused by an acute disc herniation at this level, also known as a slip disc. And so essentially this spongy material popped backwards after a young male was lifting a heavy box. And that disc was pinching off this nerve fairly severely. So the patient had excruciating pain down the left leg, and it was to the point where they were extremely weak. They could actually barely move that leg, and they had no sensation from the waist down in that leg. So when it gets to that point and the patient doesn't have any reflexes on physical examination, that actually required something more invasive and serious than even a simple injection, so we had to make an emergency referral to a neurosurgeon. He had a discectomy where they removed part of that disc, and the patient ended up doing fine a couple weeks later. This is Dr. John Birgiolas with Overcoming Pain.
You can submit your questions for next month's Overcoming Pain segment on our website, upmatters.com. You can also find more information by going to paindiagnostics.net. Our Overcoming Pain segment airs on Local 3 News the last Thursday of each month.